Let's talk about a very important topic, diabetic ketoacidosis. Diabetic ketoacidosis can be broken down into three parts for better understanding. Diabetic indicates high level of glucose in the blood, keto indicates high level of ketones in the blood and urine, and acidosis indicates anion gap metabolic acidosis. Diabetic ketoacidosis is usually seen in type 1 diabetes mellitus, which usually present in the younger age group, and this can sometimes be initial manifestation of diabetes. Talking about the manifestation, usually the initial manifestation in patients with diabetic ketoacidosis include polydipsia, polyuria, blurred vision, weight loss, and later on if there is severe diabetic ketoacidosis, they can present as altered mentation, hyperventilation, abdominal pain, which can be associated with nausea and vomiting. Talking about the causes of diabetic ketoacidosis, the major cause is stress, and stress can be because of infection, and two major infections that can cause diabetic ketoacidosis are UTI and pneumonias. The other reason for DKA could be failure of insulin pumps. And in many certain medications such as corticosteroids, SGLT2 inhibitors can also precipitate diabetic ketoacidosis, and sometimes it could be idiopathic. Talking about diagnosis, first thing that we check is glucose level in blood, and typically it will range from 300 to 800. The second thing you're gonna do is ABG, arterial blood gas, and that will indicate metabolic acidosis and bicarb of less than 18, and there will be anion gap, and there will be, if we check ketones, there will be positive ketones in serum as well as urine. Treatment for diabetic ketoacidosis, the first thing you need to give is high flow IV fluids, that is normal saline. The secondly, you will switch to IV insulin. These two usually goes together, and then you follow and replace potassium as per requirement. And for the detailed treatment, we are going to talk about it now. Now comes the most important part, management of diabetic ketoacidosis. As we talk about, there are four major components: fluids, insulin, potassium, and bicarb. Out of these four, I want you to remember fluids and insulin are must. It has to be given. Let's talk about it in detail. Let's talk about fluids. We have to give isotonic intravenous fluids immediately. The first thing you will give is isotonic IV fluids. Subsequently, we'll continue to give isotonic fluids if sodium level is less than 135. And then we switch to half normal saline if serum sodium goes more than 135, and we have to add dextrose when serum glucose level is less than 200, because we don't want a serum glucose level to go below 200. Talking about the insulin, now we reduce the insulin infusion rate when serum glucose is less than 200. As we talk about that, we don't want the patient with diabetic ketoacidosis, the glucose level should not go less than 200. If it goes less than 200, we need to hold insulin infusion. Now another situation where we need to hold insulin infusion is if the serum potassium level goes less than 3.3. Now we need to switch to subcutaneous insulin on DKA resolution. Now how do we know that DKA is coming to a resolution? So one thing is normalization of anion gap and patient is able to eat. Then we will switch from intravenous insulin to subcutaneous insulin. Talking about potassium, we only give the replacement when potassium level is less than 5.3. Talking about bicarb, we need to consider replacement for severe DKA with blood pH if it goes less than or equal to 6.9. So the main points for the student who are preparing for USMLE exams, you need to remember whenever you see a patient with DKA you always start two things: IV fluids and IV insulin. And if you have to take care, if glucose level goes less than 200, you need to decrease the level of insulin, or you can even switch to subcutaneous insulin if patient is able to eat and anion gap is getting normalized. And if glucose level is reducing less than 200, you have to add dextrose, and you need to look for potassium levels. If it is going less than 5.3, then you need to give potassium replacement. Why this is important? Because total body potassium depletion is a risk whenever we are giving insulin, because insulin can lead to hypokalemia. So these are the take home point for the students preparing for USMLE exams. Thank you.